Hi, I'm Dr. John Chrysler from the All Things Male Center for Men's Health. I practice what is coming to be known as interventional endocrinology, which is the restoration and balancing of various important hormones to improve health, happiness, and sexual function. Welcome to the Man Cave. In this episode of the Cutting Edge series, I will discuss my techniques for the application of various transdermal testosterone products to the skin. The reason the way you apply the testosterone is so important is because it can make a huge difference with respect to how much actually finds its way in your bloodstream. This affects not only your health and happiness, but also how much your testosterone replacement therapy program costs. Please watch the video through its entirety, as I have sprinkled little tricks and pearls of experience all the way through it. I'll show you the best way to put on big pharmaceutical company products such as Androgel, as well as those testosterone gels individually made by a compounding pharmacy. And the way we put on our testosterone gel also works with various other transdermal gels we commonly use in my practice, such as DHEA and pregnenolone. First, what are the advantages of using a transdermal testosterone product instead of, for instance, testosterone shots? Simply, the serum testosterone levels produced by properly applied transdermal testosterone is quite variable across the day, just like the testosterone of a young, healthy male. And as we have seen with other hormones and transmitters, variability is part and parcel of youth. Next, the opportunity to avoid putting thousands of holes in your body over your lifetime with shots is pretty hard to ignore. And then there's a risk, however small, of infection and bruising. But what are the drawbacks of transdermal testosterone? It does take a couple minutes each day to apply the gel, but as I tell my patients, if they aren't willing to invest a couple minutes each day, they're TRT. And gels are a bit more expensive than shots, but at least you don't have to worry about disposing of the needles. And since the enzymes that convert testosterone into estrogen and DHT live in the skin, there generally is more conversion to each as the testosterone passes through the skin into the subdermal layer, which is the reservoir for distribution into the bloodstream throughout the day. So there is a greater chance of needing estrogen-controlling drug with gels, such as the aromatase inhibitor anastrozole, compared to shots, even when injecting testosterone cypionate properly, which means on a weekly basis, which is necessary due to the half-life of the cypionate ester. In pharmacology, we must always consider the half-life of the medications we prescribe, and that's why injection schedules of a testosterone shot once every 3 or 4 weeks not only makes no sense, it puts a poor patient into a hormonal roller coaster where they're at anabolic steroid levels the first week, then below baseline the rest of the time. Not good. Another interesting comparison between transdermals and shots is that gels are variable across the day, but stable and consistent across the week. Testosterone shots are stable across the day, but variable across the week. And as we have noted previously, since variability is part and parcel of youth, transdermal testosterone mimics the hormones of a young man, whereas shots mimic the hormones of an old man. That's why I frequently go to multiple shots per week for my testosterone injection patients, using the newer subcutaneous injection technique. If you do a search, you will find the YouTube video that Vincent Napoli made for us right here at the Man Cave, where I offer some tips on how to do subcutaneous testosterone injections. In my professional opinion, this is the new and improved version of injectable testosterone replacement therapy. This might be a good time for me to say I do not consider the DHT boost you get from transdermal testosterone a bad thing. That is why gels are generally better than shots for treating sexual dysfunction. You may have noticed I have only spoken of using testosterone gels, not creams. Creams are for girls, gels are better for boys. Anyone who doubts that should consider the fact the multi-billion-dollar pharmaceutical giants have all put their testosterone into water-soluble gels, not creams. There are very good reasons for that, but basically gels get right through into the subdermal layer and creams tend to treat the inside of your clothing. Now, we must always be mindful of accidental exposure of testosterone gel onto others. Of course, you don't want to get testosterone onto children and never onto a woman, especially if she's pregnant. That could be disastrous. They actually did a scientific study some years ago where they put testosterone gel on a guy's chest, then had him vigorously rub for some time against a topless woman. They indeed found a small but measurable increase in her serum testosterone levels afterwards. I'm wondering how long the line was to volunteer for that study. It's been shown just the thickness of a t-shirt completely blocks the accidental transfer of testosterone to others. And if you're going to apply it to your forearms, as I will show you in a few minutes, I just tell my guys to be a gentleman and rinse off in the shower prior to romantic interludes. Speaking of showers, if you wait 2 hours after applying the gel, it should be okay to shower or swim. And that is another benefit of gels over creams. Let's get on to business. First, it's important to note that what I'm going to show you is the Dr. John way, not the way the manufacturers want their testosterone gels applied, okay? This is a demonstration placebo pack for Androgel 1%. Simply tear off the top on the dotted line and squeeze half of it onto one forearm. Now rub the forearms together and then finish off by rubbing up and down your flanks. The skin is much thinner there and you'll get better absorption. Always look on the back side of your forearms because there's usually some hiding there and you don't want to waste any of that good man gel. Then do the same with the other half of the package. There are 5 grams of gel in this package, putting 50 milligrams of testosterone onto your skin and roughly 5 milligrams into the bloodstream. And you can successfully disperse about half of that at a time without it sliding off onto the floor. If you are prescribed more than this 1 5-gram sachet, it would be best to apply half of it twice per day due to the volume involved. Heck, if it works for your particular lifestyle, it is great to apply any transdermal gel twice per day. The serum androgen profile that schedule produces is, once again, more consistently variable. This is the Testim 1% gel tube. It's a little harder to work with, but it does travel well. If you carefully pinch out all of it, maybe using the bathroom counter so you can use both hands, you will get extra a little more than 5 grams out of it. Just a little secret. The Testim product has an additional component, a permeability agent known as pentadecalactone, which is also used in the perfume industry. Now, some women seem to find it to be a powerful aphrodisiac. For them, maybe put a little behind each ear, just for the fun of it. But others simply can't stand the smell. You'll want to make sure you check with your partner to make sure she or he is not going to banish you to a life of sleeping on the couch. Honestly, I have a nose like a red bonehound and I can't smell it either way. Here is the Androgel meter dose pump bottle. I noticed this particular Androgel meter dose pump bottle also has the convenient travel lock attached. There are still a few of these floating around doctor's office these days. They're convenient because it prevents the wasting and dispersal of that man gel all over the inside your gym bag. I vastly prefer meter dose pump bottles for all gels. This one is for the new low volume Androgel. I call it the high concentration Androgel. It's up from 1% to 1.62%. There are definite advantages to the concentration increase, but also caveats about how best to apply it. The main advantage of using a higher concentration T-gel is a smaller area of application. That means not only less glazed donut effect from having to apply so much, but also has been shown to decrease the amount of testosterone to estrogen conversion. Never get the gel into this area called the antecubital fossa. The reason is because then when they stick the needle through it for the blood draw, that tiny little plug of skin with the T on it goes up into the needle, and your laboratory results will look like you are on anabolic steroids. And watch a lab tech as they scrub the area. They start in the center and circle out. If they go down here where the T-gel is, then back to the center again, the same thing can happen. You now know more about this than they do, and you'll need to share your knowledge if you want the best results. Using urinary testing, of course, avoids this issue entirely. If all else fails, you can have them use what they call a butterfly needle somewhere else. If you use your hands to apply the 1% gel, you lose about 1 gram of it into your palms. The palmar surface will merely absorb the gel, like hand lotion, but the thickness and density of the tissue means the testosterone will never see your bloodstream. So with a higher concentration, you actually lose more total testosterone per daily dose if you use your hands. This is why some people have reported they're getting worse results with a new Androgel at the same daily dose, and why I recommend my technique of using the forearms and your flanks. You get more bang for the buck. One of my patients told me he uses the bottom of a rock glass to apply the T-gel to other areas of the body because he can't put it on his forearms due to the fact he has small children in the house. I always advise my patients to hug their kids all they can now because you won't get within arm's length of them once they hit their teens. Of note, any way you apply it, always apply your testosterone gel on lab testing day the same way you normally do so your doctor gets an accurate picture of what your serum hormone levels look like normally. This is the Fortesta 2% gel, a relative newcomer to the market. I like it very well too. These big pharma T-gels are all fine products, and your local doctor may feel more comfortable using them, especially since insurance companies are more likely to cover them. But for those without prescription coverage, or who just want a higher concentration T-gel, the much less expensive compounded gels are the way to go. They come in 5, 10, and even 20% concentrations. No matter what anyone says, it is very difficult to get enough testosterone into a gel to get it up to a full 20%. Be advised. The higher concentration of testosterone in these compounded products, by virtue of the fact the area of application is so much smaller, often allow us to avoid the use of an aromatase inhibitor to keep estrogen conversion in check. That means less drugs and lower cost. At any concentration, I love the meter dose pump bottle at 1/2 ml per pump. That's 2 pumps per ml. That means, for instance, each pump of 50 mg per ml concentration puts 25 mg of testosterone onto the skin. You can see how that helps when we're making dose adjustments to titrate you up, as always with hormones, starting low and going slow. Here are a few more pearls which may help you. Always try to get the blood draw done about 2 hours after applying the gel in order to hit that first peak. Then we can see how much is actually getting in. Of course, using the 24-hour urine testing I vastly prefer takes care of all that, as we're then getting the area under the curve for total testosterone absorption across the entire 24 hours. I've heard many times of situations where patients did not apply their T-gel before going into their labs. Well, we can't test to find out how much of the drug actually got in unless you take the drug. You're also then testing in a place your body never should be, more than 24 hours after an application. Maybe I should also note all transdermals of all hormones need to be taken every day. The best time to apply a water-based gel is right after toweling off from a shower. Absorption is much better. It's also more convenient, as that is when you have your shirt off prior to dressing for the day. And Vince wants to make sure I share with you that it can really help with absorption of the T-gel if you keep the skin nice and soft. Therefore, applying a good emollient is important, especially during the dry winter months. But don't put it on right before you apply the T-gel, or the oily lotion will form a barrier to the absorption of the testosterone. About 12 hours off seems to be the best. And avoid petroleum-based skincare products. If you still aren't absorbing well, look to thyroid issues. The most reliable laboratory test there is the free T3 assay, which should be part of every proper thyroid evaluation anyway. For those with really low testosterone levels, those with low sex hormone binding globulin, especially those prone to anxiety, those with very high sex hormone binding globulin levels, those who are what we call hypermetabolizers and or hyperexcretors, and I seem to catch all the tough cases, you probably are going to end up being a testosterone injection player anyways. But as I always say, everyone is different. Everyone who is a patient of mine or has read any of my stuff on my Men's Health Forum, which by the way is free to join, knows, in my professional opinion, the very best testosterone replacement therapy regimen out there is a daily T-gel along with a daily HCG shot. I think most people should try such a protocol first prior to going on shots. You know, it just seems you can't get the guys who previously used anabolic steroids to ever even try a gel. Its shots are nothing for them. I do have a significant number of patients whose symptoms never recovered from doing steroids. While the various protocols I use in my medical practice to help them recover their natural testosterone production works for most, for some reason some of them just never do. So it's a lifetime of TRT for them. For these guys, actually all testosterone replacement therapy patients, the addition of daily HCG to their TRT regimen can work wonders to help normalize their other hormonal pathways. Basically, I like to backfill the pathways with HCG, DHEA, and even transdermal pregnenolone. That will be a discussion for a future cutting edge video edition. I hope this helps. Good luck to you.
For a free copy of Dr. Chrysler's TRT, A Recipe for Success, go to allthingsmale.com, click on Publications, and navigate to TRT, A Recipe for Success, where you'll be able to download his comprehensive guide to testosterone replacement therapy.